As a nurse, we can literally watch every heartbeat and every breath.
We are the ones that are at the bedside for 24 hours a day, providing that backbreaking care.
And that care can come in any number of settings, from visiting nurses who brave the elements to treat patients in their own homes, to school nurses, to the thousands of nurses who suited up to battle COVID in emergency rooms and ICU units at every Boston hospital.
We'd never seen anything like it. You would open the door and it would just be ventilator, 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 ventilator outside every single door.
It was hard. It was hard for everybody because not only professionally, but personally, everybody was having their own battles at home. I was very scared to get the disease, I have a couple of patients that they were very short of breath. And just for me to think I could be that short of breath, it scared me.
You know, things were changing so rapidly. And in those early days, a lot of times it felt like we were kind of practicing medicine in the dark a little bit. We didn't know, if what we were doing was working.
I have 3 kids at home, so they were very scared, I must say. I could see the fear in their, on their faces every time I entered the house because they were not quite sure whether or not I was bringing anything home.
Marlene Texera is a community nurse at the Bowdoin Street Health Center until her clinic was turned into a COVID testing site.
Not easy, just, again, putting that gown on, putting the mask on, the goggles, and just hoping that, I'm protected enough to go out and swab someone and just, thinking again, is this the day that I come in contact with someone?
I set up an area at home where every day I would come in, get undressed, put my clothes right directly into an extra hot wash, go to a separate shower that I had, decon myself, and then I would backtrack with sanitary wipes.
I try to leave as much as I can here at work. Even with my shoes, I had like 3 pairs of shoes. I had one from the house to the car, then one from the car to the building, and once I get to the building, I use a different pair of shoes.
I remember early on when we weren't sure of how it was transmitted or what was happening. I came home from work one day and the recliner was set up in the living room separate from the couch. And the kids asked me, "Dad, can you stay in the recliner?"
Throughout the year, these nurses say their colleagues lifted them up, and each witnessed small acts of compassion that made a big difference.
Seeing the amount of patients pass away that we did without their families at the bedside, without any emotional support, and we kind of really became the go-between between the families and the patient.
I had one coworker who sat in a room for almost 2 hours holding an iPad, so a very sick end-of-life patient could see their families, and their families could say their goodbyes. I had another coworker whose patient's family, couldn't use Zoom, and they didn't have anybody coming in. And so she just stayed with him and sat with him and held his hand as he passed.
I always stop and have a moment and send a prayer for the people that didn't make it.
As we're witnessing today, heroism comes in all forms. These nurses may not be dwelling on what they did, but they all had the same message for their colleagues.
I will say thank you. Thank you a million times for the professional emotional support. I couldn't done it without it.
Thank you for all that you're doing, all that you continue to do. You are appreciated more than you know.
For standing beside me and standing together and supporting each other.
That there is hope. There is hope with the vaccination, and there's lights at the end of the tunnel, I think.
I think just thank you, and I'm so proud of you. And when the pandemic starts to fade, and I think the spotlight on nursing kind of goes back to the way that it always was, we'll still be there for each other.